Hello and welcome to the fourth of a five-part webinar series brought to you by Wespath Benefits and Investments and the General Commission on the Status and Role of Women. Today's webinar is Understanding Anxiety and Depression. I am Leah Holzwarth, Manager of Health and Wellbeing from Wespath Benefits and Investments, and our presenter today is the Reverend Leigh Goodrich from the General Commission on the Status and Role of Women. We are excited that you have taken the time to join us for this fourth in our Tools for Better Wellbeing webinar series. Today's webinar, Leigh will be covering and going through the agenda, which is defining anxiety and depression, their impact on your well-being, getting help for anxiety and depression, and then also sharing some resources. So to get to know everybody a little bit better, we would like to know where you're from. So you want to open up your toolbar, and if it's not open, you're going to click on the orange arrow, and that will open it up, and then look down on that tab. No, here. Leigh, you're going to need to click on that screen. Whoop. Okay. Now do you see it? No. Okay, we understand we've got a little bit of technical difficulties. So let's go ahead and see, and we're going to go ahead and get, let's see if that does. Nope, that's going to do it. Yeah, will you go ahead and get the IT person to help us out? And so hold on with us. Our first thing we want you to do is kind of get ready, and I will talk you through our next step, what our steps are. And then what we're going to do is we're going to ask you where you're located. So while on our screen we have a map of the world, but on your screen we understand you still just have our cover slide. But what I want you to do is go into the chat function or the question function that is on your toolbar, and you're going to see questions. And we see we've got some people already that have done that. Go ahead and just type in and tell us where you're listening in from. We have some people from California, from Minnesota, from the Chicago area. Whew, you guys are good at this. Dallas, Texas, what else? Colorado, Arkansas, Northern Illinois, Indiana, Georgia, New Jersey, whew, Texas again. And I think we've got the map up. Yay! Thanks, Joe. It's always good to have good IT support. So we are doing great here. Anybody else? Oh, New Jersey? I'm sorry, New York? All right, the map is on. Okay, thanks everybody. That's awesome. So we're coming from all over the United States, which makes us very excited. And thank you again for your time and joining us. Our next question we would like to do is we would like to know what your role in ministry is. So using that question bar again, go ahead and type in, are you a clergy or laity? Do you work at a UMC agency or a lay pastor or a faith community nurse? So go ahead and tell us what your role in ministry is. Okay, we have a clergy spouse, we have agency staff, we have a pastor, we have associate pastor, congregational care, benefits specialist, clergy in a local church, pastor. All right, care support. Okay, all right, awesome. So we have, not only are we from all over the United States, we have a lot of different roles. That's exciting. So, all right, so the next step we will do is I'm just going to go ahead and make our, reintroduce the webinar, which is Understanding Anxiety and Depression. And then to make our legal team happy, just to run through the disclaimer that the information in this webinar is provided by Wespath Benefits and Investments, Center for Health, and the General Commission on the Status and Role of Women as an educational service. The Center for Health and COSGRO sharing of this general information should not be construed as, does not constitute, and should not be relied upon medical advice or any other professional advice or services in any specific matter. All right, so that made our legal team happy, which is great. And on that note, it's my pleasure to introduce Leigh Goodrich.
Well, thank you, Leah.
No, wait, I was going to give you a quick bio.
Well,
okay. All right, sorry. Okay. The Reverend Leigh Goodrich is an elder and member of the New England Annual Conference. She spent 14 years in business administration and earned a master's degree in industrial and organizational behavior before answering a call to ordained ministry. Graduated in 2002 from Boston University School of Theology, summa cum laude. Congratulations.
Wow.
Her first appointment was to start a new church, which she pastored for 9 years. Then she was appointed to the United Methodist Church in Lexington, Massachusetts, serving there for 4 years before accepting her position at Cosgrove. So welcome, Leah, and thank you for being here.
Well, thank you, Leah. It's really nice to be here. And I'm going to begin this afternoon by talking about anxiety, and then we'll move on and talk about depression. So, it's completely normal to experience some anxiety and fear in life. Anxiety should not be considered something that is bad or negative. In fact, those feelings are part of your normal survival mechanism. Your heart rate quickens, you breathe faster, your muscles tense, and your mind is at high alert as your body prepares to defend itself or to flee from a threat. It's only when anxiety and fear linger on and interfere with normal activities that it becomes a problem. A person who worries excessively and unrealistically for 6 months or longer may have what is called generalized anxiety disorder. It's not that the worries themselves are a problem, but the extent of the worrying. So, for example, if you worry because your child is late coming home from school, that's normal. However, if it causes a rising sense of terror, even after he or she has safely arrived home and persists for weeks and months, this is a problem. So anxiety becomes a problem when it is persistent, when no amount of reason can help control it, when the person feels overwhelmed, even by simple tasks, when there is an excessive, irrational dread of everyday situations, and finally, when the anxiety becomes disabling to the point where one can no longer function in daily activities. There are many types of anxiety, but the 6 most common include the following list. Generalized anxiety disorder. It's marked by a sense of anxiety most days about lots of different things. And if it lasts 6 months or longer, it is generalized anxiety disorder. The second kind are social phobias, and that's when a person has an intense fear of being criticized or embarrassed or humiliated in public, even in everyday situations like speaking publicly, eating in public, being assertive at work, or speaking out in a class. That would be a social phobia. Specific phobias occur when a person feels very fearful of a particular object or a situation. Going to the doctor or riding in an airplane are just 2 examples of specific phobias. Obsessive-compulsive disorder happens when a person has an ongoing, intrusive thought that causes anxiety. And although they acknowledge that these thoughts are silly, they try to relieve their anxiety by carrying out certain behaviors, like washing their hands or cleaning their house excessively. Post-traumatic stress disorder is something we hear about a lot these days. It can occur anytime after a person experiences a traumatic event like war, assault, accident, or disaster. Symptoms include difficulty relaxing, upsetting dreams or flashbacks, and avoidance of anything relating to that event. And then finally, panic disorder is characterized by an intense, overwhelming, and uncontrollable feeling of anxiety combined with any number of physical symptoms like shortness of breath, increased heart rate, and dizziness. Sometimes people believe that they are having a heart attack and that they're going to die when they experience panic disorder. This has also been called a panic attack. So if you've heard people talk about a panic attack, that is panic disorder. Anxiety disorders are real. They are serious medical conditions, just like high blood pressure or diabetes or heart disease. They are the most common psychiatric illness affecting children and adults. 40 million Americans suffer with anxiety disorders, but only about a third of them seek treatment. But here's the really good news. These disorders are highly treatable. An interesting aspect of anxiety disorder is the different ways it affects men and women. Researchers attribute this difference to our brain chemistry. So in women, they find that the fight or flight response is activated more readily in women. Women just seem to be more sensitive to those particular chemicals that begin that fight or flight response. And it seems that it stays activated longer in women. So from puberty to age 50, women are 2 times more likely than men to be diagnosed with an anxiety disorder. Anxiety is always a serious problem, but anxiety in men may be especially problematic because men are less likely to seek help and understand the importance of addressing their symptoms. At least this seems to be what the research shows. Men frequently try to fight it, they isolate themselves, or use false coping mechanisms like alcohol, gambling, or other reckless behaviors. What is interesting is that general practitioners are more likely to refer men to mental health specialists than women, suggesting that general practitioners are more comfortable treating women with anxiety disorders than men. Now let's move on to depression. Depression is a bit like anxiety in that it's normal to experience sadness and discouragement. However, when symptoms persist, and in the case of depression for more than 2 weeks, and feelings interfere with daily activity, it's time to seek help. Depression, like anxiety, is a treatable disease that affects the way a person thinks, feels, behaves, and functions. At any time, 3 to 5% of people suffer from depression, and the lifetime risk is 17%. And again, like anxiety, men and women experience depression differently. So in men, depression is marked by these symptoms: tiredness, irritability, just not feeling like oneself. Sometimes men become angry. Sometimes they engage in reckless behavior or will abuse drugs or alcohol. In contrast, women seem to experience sadness, worthlessness, and guilt. Now, there are many different types of depression, and in women there are 4 that are most common. 3 to 5% of menstruating women experience premenstrual dysphoric disorder. It's a severe form of premenstrual syndrome that becomes very severe 7 to 10 days before menstruation. Women also experience postpartum depression, which is experienced by about 13% of women 1 week to 1 month after delivery, and 30 to 70% who experience this will deal with the symptoms for 1 year or longer. The third is postpartum obsessive compulsive disorder, and it's experienced by 3 to 5% of new mothers. And about 9% of women experience postpartum post-traumatic stress disorder following childbirth. About 15 million people experience depression each year. And women, again, are twice as likely as men to develop clinical depression. Up to 1 in 4 women is likely to have an episode at some time in her life. And experts believe that this has to do with the hormonal shifts that happen throughout life. A key finding in the 2017 Wespath Clergy Wellbeing Survey found that 28% of clergy have at least some functional difficulty from depressive symptoms. That is higher than the normal demographically matched sample of U.S. adults. So depression is frequent and ongoing. So what increases the chances of depression in women? Well, much of this might have to do with reproductive, genetic, or biological factors. Some experts believe that increased depression in women may be related to changes in hormone levels throughout a woman's life. The onset of puberty, pregnancy, menopause, as well as giving birth or experiencing miscarriage seem to be triggers for depression. However, there are other factors. For example, interpersonal factors may be part of the dynamic. A disappointing relationship or some other situation that arises could be a cause of depression. There also are certain psychological and personality characteristics that lend themselves more to being depressed. And in today's world, the stress of juggling work and raising children, or simply just being a single parent, can be very stressful and create depression in women. So, depression is serious, and like anxiety, depression is serious and highly treatable. So let's remember that both of these circumstances are highly treatable. So what do you do if someone you know seems to be experiencing anxiety or depression? Well, here are some of the things that you can do to help someone. First of all, it's not a problem to let them know that you've noticed a change in their behavior. Be honest and give true feedback about the behavior that you've seen. Spend some time listening to them. Help them to be heard. Let them know that you care about what they're feeling. Always suggest that they see their doctor or their health professional and get a thorough workup to determine if what is concerning them is anxiety or depression. And if you can, help them to get the appointment and offer to go with them. It's really helpful to have another person in that doctor's appointment to tell anecdotes about some of the behaviors that they've seen you experiencing and some of the feelings that you've shared with them. Encourage them to get enough sleep, to exercise, and to eat well. These 3 things are critically important to reduce stress and to keep anxiety and depression at bay. Discourage the use of alcohol or drugs to feel better. These things will not help them to feel better. The thing that will help them feel better is to get treatment by a physician or a mental health professional. And then contact a doctor or a hospital if you think that they're going to be a threat to themselves or to other people. It's important to know that many companies offer completely confidential employee assistance programs, or EAPs, to help participants work through emotional issues. If you think that you may be suffering from anxiety or depression, seek the counsel of a medical professional who can provide a diagnosis and a treatment. And now, what are some of your experiences and thoughts? What can you share with us about your experiences with anxiety and depression? You can just go ahead and use the chat box on the lower right-hand corner of your screen, in the question box, in the right-hand corner of your screen. Do you know anyone who has experienced anxiety or depression?
Okay, so we have one quick question. A change in an appointment can bring on a period of anxiety, not only for that pastor or clergy, but also for the family members too.
Absolutely, and that's one of the career vocational issues that pastors oftentimes encounter. And so be really careful, watch your family members, make sure everyone is on the lookout for signs that anxiety is lasting too long. 6 months is a good period of time to wait for anxiety. But if you have signs of depression and they're lasting more than 2 weeks, you really want to see a physician or mental health professional. Thank you. That was a great comment.
Okay, we have another question that just came in. Clergy depression, how does it compare to other professionals? Do clergy have more levels of depression, or more levels of depression and anxiety, or are they similar to other professionals?
So according to the data that Wespath has been able to find in the work that they've been doing, we know that 7% of United Methodist clergy suffer from depression. And this translates into about twice the number of people who come from a similar demographic. Also, at 28% of clergy experience at least some difficulty working or taking care of things or getting along with people because of depressive symptoms. So this is a really big problem for clergy in particular.
So, we have another quick question about the role of social support for somebody who might have anxiety or depression. What can you do either as a friend, or does having a broader social group or support structure help?
Yeah, you know, it's a great idea to have a strong social support and to have friends and to have people that you can talk to. But don't ignore the symptoms that you're seeing of your anxiety or depression. Make sure that you address them, again, with a health professional or a mental health practitioner. The thing is that, as I said a couple of times, anxiety and depression are very treatable diseases, and they are diseases. They're caused by chemical imbalances in the brain, and there are medications and there are treatments that can help. So be sure that you supplement your strong group of friends, maybe even pastoral counselors and other resources with some medical advice.
Are there special resources within the United Methodist Church that are geared just towards pastors? Like, where would you find a pastoral counselor? Can you go to your conference office and ask, or you may not want to?
Yes. So you could go to your, you could go to, your pastor could go to their SPRC. They can go to, they can contact a person in their annual conference. There may be a counseling group that's part of your annual conference. One of the really important and concerning aspects about mental health concerns is always the need for privacy. And so in the United Methodist Church, we have employee assistance programs that will allow you to keep your privacy and seek help without anyone knowing it. So really just understanding what the boundaries are around confidentiality is helpful when you're seeking.
And another question that we have is, what is the best way to find a professional who is a good match for your needs and also for insurance reasons? So how would you find how would you find a good counselor? Ask friends, family?
So asking friends and family is one way to do that, but again, then you have the problem of confidentiality. The other piece is to ask your doctor, your general practitioner, for referral. You can also go to a practice in your particular community, a mental health practice in your community, and they will give you a list of the different people who might be able to help you. And then you can interview them and see which of them might be a better fit for you.
There's a lot of stigma around mental health. Is there a good way to help combat that, or feel that it's, that it's really okay and you're being very strong to know that when you need help and find it?
Yes, you are being very strong when you seek help for mental health, and it is really important for you to do that. It is a strength, not a weakness, to address the symptoms that you have of any kind of a mental health disorder. So you definitely want to go ahead and do that.
Okay, any other questions that may come up? So any other resources that you may know about or that you would like to share?
Well, there are a number of resources up here on our screen right now. We hope that you will take some time and use WebMD medical reference. They have a very strong resource on anxiety and understanding anxiety as well as depression. And then the Anxiety and Depression Association of America is very helpful in providing articles and information about anxiety and depression. And then the organization Beyond Blue is based out of Australia, but is very, very helpful and has a lot of information that we can use as practitioners.
So as a former practitioner or pastor, you still are, but if you're a local pastor in a church, do you have suggestions or resources or ideas that if somebody from the congregation comes to you, how would you help them or give them resources?
So, yes, anytime a person comes to me, it would be my practice to sit, to listen to them, and to encourage them to go see a medical professional. As a clergy person, I am happy to listen and hear the concerns of any person in my community. However, I have to understand the limits of my professional ability as well. And so the minute that I feel as if someone has a serious mental health issue, then I would refer them on.
And then any other questions that are out there? I know we had one quick question about receiving a copy of the PowerPoint and all the resources. We will do that. I will also give you, send you a link of the presentation when it's done. So that will be in your inbox either tomorrow or Monday. However fast we can get those resources to you, we will do so. Before we let Leigh go, I want to know if there's any more questions or anybody has any thoughts or would like to share an experience that they may have, or any other questions regarding helping somebody with anxiety and depression. All right. So just coming from the Center for Health and Wespath, we do have a lot of resources that are on the Wespath website. So you can go to wespath.org, and if you click on Center for Health and then information, there's some resources there. Or you can just type in anxiety and depression, and you'll be able to see some information that we have vetted and put on our website. Also, our quarterly newsletters have addressed emotional health as well. So you can go ahead and find all of those on those websites. So to that end, I don't think we have any more questions. I would like to thank everyone who has participated in Understanding Anxiety and Depression webinar. We have one more webinar on tap. It's going to be Tuesday, November 28th at 2 p.m. Central Time. Shelley Brooks-Stanford from the Center from Wespath Benefits Investment Center for Health will be leading What You Need to Know About Prediabetes. We introduced and did this webinar back in May and have had a lot of requests for it again. Prediabetes and diabetes is a big issue within not only the United Methodist Church, but across the United States. So sooner or later, either one of us will be dealing with it, or we have a friend or loved one that is. So you can find that registration by going back to the wespath.org. Our website and clicking on the Center for Health, and then go to information, and then you'll see the webinars there, and you can click on that and look for the toolkits for better well-being, and there'll be a link there. Either that, or I'll try to remember when I send the email out that maybe I can go ahead and include it there for your ease. So again, thank you for your time and your participation, and we hope that you can join us at the end of the month for the prediabetes talk, and I will wish you a very happy Thanksgiving. All right, thank you.